I'm Connie Franklin. I'm here with Dr. Anu Bajaj, certified by the American Board of Plastic Surgery. She's been in practice for over 20 years and very well known, not just here in Oklahoma City, but nationally, I might add. Let's talk a little bit about fat grafting. Fat grafting versus fillers.
So, one thing to keep in mind is we didn't really have facial fillers until the early 2000s.
What were we doing before that?
We were fat grafting.
Oh,
So, we would fat graft people's faces and their lips, and that's what we would use to augment. So, fat grafting is the oldest filler, right? But I think one thing to understand is fat grafting is not always perfect, depending on where we're injecting it and what our goals and expectations are.
okay. So what are some of the things to expect as far as, not being perfect?
So, with fat grafting, what you're doing is you're essentially suctioning the fat from a body area where you don't want it,
Okay.
processing it or washing it in a certain way, and injecting it into an area where you do want it.
Okay.
So, once you inject it, it doesn't have a blood supply. What you're asking it to do is to gain a blood supply from the surrounding tissues.
Okay.
So that means you can't inject it in excessively large volumes. Otherwise, you could have issues such as fat necrosis or oil cysts, which can develop. So you want to make sure it's injected in small layers.
Okay.
So that's one of the limitations. So that's why that's what makes fat grafting a good option for small areas such as the face, improving contour irregularities on the breast, for example, but not the ideal or a great option for a breast augmentation, for example.
Because people are wanting a predictable volume in a larger than.
Correct. When people come in for a breast augmentation, they're wanting fullness and an increase in size. If I were to fat graft the breasts, if you think about the surface area of your breast being about the size of my hand, and I want to inject it in small, thin layers between the skin layer and the breast layer so that fat gets a blood supply, I'm limited to injecting, say, 150 to 200 cc's of fat, out of which we know that about half, 50%, maybe 70% will take. So it's an unpredictable increase in volume because we're not injecting that much.
Mm-hmm.
And it's not going to give you a big increase in size unless you're willing to undergo 2, 3, 4, 5 procedures to have that done,
Mm-hmm.
which is financially or economically, nobody wants to have that many surgeries, and
Right.
most of us don't want to spend that kind of money either.
But you still do it. And so who is this good candidate for this?
I think fat grafting to the breast is great for improving contour irregularities and just giving subtle increases in fullness. So most commonly, it's frequently done in individuals who've had breast cancer and breast reconstruction because they've had a mastectomy and lost their entire breast and now have an implant or some type of a reconstruction. And so fat can be injected to help improve those contour irregularities, decrease rippling after an implant because you're just asking for a subtle improvement.
Mm-hmm.
The other time where I see fat grafting being really useful is in women who are having their implants removed and are having a lift and just want a subtle increase in the superior aspect or a smoothing of that area with fat. And that works really well.
But you also have to be a good liposuction candidate.
Yes, you have to have the fat that we can suck out. If you don't have any fat, I don't know where I'm going to get it. Although we have some options for small volumes that don't involve getting
Cutting
lipo
edge,
near fat.
brand
Yes.
new. Oh, she just dropped the little teaser there. Yes, we now have access to this cutting edge technology. Tell us about alloClae.
So alloClae was recently approved by the FDA, and what it is it's fat. And it's sourced so that it's not going to result in an immune reaction, but we can inject it, and it will take, same issues, it'll take probably about 50 to 70%,
Mm-hmm.
and you can inject it in small volumes as small as 12.5 cc's or even more. And it works well for improving the contour of the breast along the superior aspect, or what they did the FDA studies on were hip dips, because you would inject 50 to 100 cc's per hip dip, and they had good volume retention based on those studies.
Face, is it used in the face?
So alloClae, the fat molecule is too large, so it's not used in the face. There is another product that's been used in the face called Renuva.
Okay. Is alloClae going to be for people who have maybe the fat, like if we've had hip dip a patient who it didn't take the last time they did it with their own fat, is there more of a chance for alloClae to work, or are they just not going to be a good candidate?
It's worth a shot with the alloClae. I do think it will work.
Why is that?
Because of the way it's been processed, and their studies show that it does have good retention.
It's been through the lab.
Yes.
Whereas our own bodies don't have, there's no way to test the quality of our fat and all that, right? So
it has to do with the quality of the fat. It has to do with the way the fat's handled, whether any of the fat cells were injured during the handling process. All of those things do affect how good fat grafting takes.
Okay. So fat grafting to the face. If a patient's coming in and wants to do a full face rebalancing, who's a good candidate for that? And what are the pros and cons?
So we can do fat grafting to the face. It's smaller volumes than fat grafting to other body parts.
Mm-hmm.
And so I do think it's a good option for somebody who has realistic expectations. The risks or downsides are not all the fat that's injected will take. That you may have some asymmetry because you may have some fat that takes more on your right cheek versus your left cheek, which may result in needing a touch-up to improve this asymmetry.
It doesn't mean you have to walk around looking all wonky, right? It just means a touch-up.
So you have to be understanding that you may require touch-ups, which is probably true for any aesthetic procedure that we perform. There is always the chance that we have to do little touch-ups and tweaks to improve the aesthetics. The other component of fat grafting to the face that sometimes is discussed or is not discussed are the regenerative potentials. There are ways in which we can process the fat that we get to inject into the face in where we essentially emulsify the fat molecule and create what is known as nanofat. And that's fat that can be passed through a very small needle, like even a 27 or 30 gauge needle. So the fat cells are much smaller. And there is some data that's out there that shows that that helps to improve skin quality, which is another thing we've talked about. And it has more regenerative potential rather than volume filling potential.
So getting a little bit of a refresh benefits there.
Right. So some people will use that in an injectable form to help stimulate collagen, say in the neck or the lower eyelids. Other people take that nano fat and use it with microneedling to help get it into the skin and use that to help regenerate or stimulate collagen development.
So how do you make your recommendation to a patient who's wanting a facial rebalancing or wanting to restore volume to their face? How do you decide, do I guide you towards a filler or do I guide you towards fat? What's the difference?
It depends on what the patient's goals are and what they want. The vast majority of patients I see want something predictable, want something that doesn't require a procedure, want something they can come in, have it done, and then go home without any downtime, essentially.
And that is?
After filler? Yes. And that is filler. That is correct. That would be after filler. Because fat grafting is still going to be a procedure that even if it's done under local anesthesia, it will result in bruising and injury to the donor site where we harvest the fat via liposuction.
The donor site.
And then also injecting it to the face, you'll have swelling and discomfort. And so you do, at the very least, require some degree of sedation and local anesthesia. Although if it's a larger area that's involved, it may even require a general anesthetic.
Okay. So those make it very different as far as who's going to be choosing. You can come right in and do filler and leave without any, a couple little ice packs on your face or cool compress, right?
Yeah, and then you just don't work out for 24 hours and you have a few bruises and you move on.
Yeah.
Whereas with fat grafting, it's not always so simple.
And yet the filler is going to last. It's all different in different parts of the face, but it's more temporary.
Filler is more temporary, but the way or how much it lasts depends on the type of filler, where it was injected, and there's so many variables that determine how long it will last.
All right. Any other thoughts on fat grafting?
Mm-mm.
Okay. Well, I think that was great. Thank you for educating us all and informing us on the differences between fat grafting and filler. I appreciate your time. If you have more questions, give us a call at Bajaj Plastic Surgery. We look forward to talking to you. Thanks for watching. Now do me a favor, hit that like button and subscribe.